Welcome to The Pulse with Lauren Baingo, a DLL podcast series. This is your place for tips, trends, and insights into the world of healthcare finance. Now, here's Lauren.
Welcome back, everybody. I am joined today by Steve Sullivan. Steve, you are one of our commercial leaders and responsible for our largest global accounts as well as our new business development team. Is that right?
It is, Lauren. Yes, thank you.
Can you talk to me a little bit about your background? You've been doing this for a minute.
Yeah. Oh, well, I have actually. It's been 30 plus years, I guess, in the healthcare industry. I know, right?
Since you were 5.
No, it's been longer than that. It's definitely been longer than that. It was lucky enough, something I got into early in my career, and the healthcare marketplace is something that, always fascinated me, and it was always changing. And gosh, just to think of some of the things that were back then, MRIs coming out was a big thing. And, just all the changes that have happened over the years has been fascinating. And to
That's
watch
so
it change.
Cool.
To watch it change has been really cool.
That's awesome. And it's so fun to know that we have such an important place in that market and in the changes. So I wanted to talk to you today specifically about the medical device industry and the U.S. specifically. Since most of our listeners are here in the U.S., we have yet to go global, but we will. Just wait.
We'll get there. We'll get there. Sure.
Leaps and bounds here. But can you tell me a little bit about the trends that you've been seeing? Because, with the oversight that you have, I've got to imagine that you're seeing lots in this space.
It is. And you referenced the U.S. and for the accounts that we have, most of them are global that we deal with in my group, and what we'll do is I kind of break it down from what I see, like you said, to the U.S. because it is fascinating, and that's probably a whole nother podcast about the different reimbursement systems and the different models that are around the world. But for ours here at home, which you and I share, it's really amazing how much changes they've gone through, and the COVID thing really threw a wrench in all of the progress or decline or upside that was happening in certain markets. I mean, it really kind of threw everybody a loop, because you had, the typical saying was, the good thing about healthcare from a business standpoint is it's raises 5 or 6%. The bad thing is it only raises 5 or 6%. And so,
right.
And I think that from our GBU or our business unit, it's something that we always sort of expected for and budgeted for, but then the flat
COVID
line
happened.
Yeah, the flat line that happened over the 20 and 21 really kind of was completely unexpected, and obviously we scrambled a little bit because of our partners and because of some of the things that they dealt with. And there were shipping problems, there were interest rate issues, there were just getting people to come in and build the machines to send them and ship them, and all of those things are something that we played a major role in what we do over the last couple of years. But now that we're on the other side of that, it's even more interesting to see really the behavior of the customers and the manufacturers and how they're having to deal with it.
Yeah, well, and some of them are still dealing with it, right? I mean, it's not quite the shipping delays, and it's not quite obviously COVID shutdowns, but the labor costs and things like that still exist.
Well, absolutely. I mean, you've got you have just a ton of recession and inflationary pressures driving up the hospital's cost, and like you just mentioned, labor, utilities, all the other expenses. The OEMs, I mean, it's volatile for them in their orders and the forecasting that they've done, and especially when it comes to what we do is in the finance piece of it, that uncertainty around the cash flow limitations or the sort of the fight for whatever's in the budget. I mean, we're really feeling that quite strong, and having to almost rethink some strategies on what we offer our partners and how we let them go to business.
Wow, that's crazy. So as we're rethinking those strategies, and because we know that the hospitals still need equipment, people are still getting sick and injured, and they need the best of the best when they're getting that care that they need. So we know that hospitals need to either replace or even repair the equipment that they have. And with capital budgets being decreased and freezing, leasing is important, financing is important. So, is there something that our vendor partners should think about in terms of are there trends for financing? Is there something that they should keep in the back of their mind in terms of how to use us when they're having those initial conversations with their customers?
Yeah, I mean, I think it comes down to just when you're talking about some of the larger organizations or maybe your hospital associations. I think you're looking at how are they purchasing things and what are their budgets available? I mean, because that's the biggest problem I think that we've seen with a lot of the major medical companies that we work with are, the hospitals are just under constraints with cash, and they're, whether it's moving to, some massive IT system, which everybody in the world knows that it seems to be under, or it's, the labor shortages, or, trying to just keep the doors open with declining revenue, or whatever it may be. It's really becoming a challenge on those extra dollars. And I think, you have to look at reimbursement rates, and I think you have to look at your specific product on how is that being reimbursed and where's that money coming from? Is it something that's happening inside the hospital, or is it something that's happening outside of the hospital, which is a huge undertaking now? Is there, things are moving away from in care to that outpatient care. And I think that creativity that we have and the offerings that we are working with our partners on is whether it's a bundled type arrangement, which seems to be very popular right now in that mid-ticket world of, if a manufacturer sells reagents or disposables or whatever it may be that they can include with the equipment and service, and things like that are really becoming a fast break into these locations.
It's funny that you mentioned that, because I think one of the things I've recently been reading and noticing in some of the areas that I manage is that the decision maker group has been evolving too, right? And so we're seeing more CIOs and even these chief population health officers being part of the decision, where previously it was more chief medical, chief nursing officer. And so when the CIO is involved, and you're bundling with service and software and things like that, that makes so much sense to me. Kind of how that's evolving.
Yeah, I think the amount of information, the data that they're using to make decisions has really increased, and I think that's something that we overlooked in the past, and maybe it wasn't even available. But you're right. I mean, inside the hospitals and the trends and the reimbursement and the data driven mindset that these hospitals have now, they can really tell what's making money and what isn't, and the things that aren't making money are really not being backed or sort of embraced at all, and they're quick to change and turn on those. And it's another interesting thing that we ran into is these hospitals are also taking that data driven model and they're outsourcing it, and some of that data is very valuable to the insurance companies and some of the other companies. So even we're seeing some private equity come in and put together some models that surround themselves around some of that data. So
I guess when it comes to financing, if they have that data available and can share kind of reimbursement trends or what they're thinking of or whatever, we can also get creative in terms of the financing options that we offer.
That's right. And the manufacturers are a key role to all of that. I mean, they are, nobody's closer than them to their customers. And we can talk about behaviors, and we can talk about the budget cycles and what the hospitals are doing. And from history, we've got master contracts with most of these large systems, if not all of them in the country at some point or another. So we understand their behavior. It's the systems that they have, whether it's a new model that's coming out in 36 months, and are they going to have to upgrade that soon? And what is the plan for that specific piece of equipment in that manufacturer? That's really the kind of deep dive that we do and help them get to that next level.
That's awesome. So last question before I let you go and get on with your day. And thank you so much for doing this. Any last word of advice to those that are listening? So these are our vendor partner sales teams. Anything that you would suggest that they do when they're thinking about financing?
Yeah, I think it's I think the age old thing of working with our partners and the thing that we do best is when we're involved early. I mean, I think if we're on the calls with them on a Monday morning when they're going through their forecasts and they're overcoming some objections, or they're having trouble, with a certain customer that's not making a decision. Those are the types of problems that we like to solve, or at least bring up a couple different things that may help them close that deal a little bit sooner. So certainly getting us involved in early to help them pull a trigger. I think the budget cycles and the understanding that we have around those will certainly be a good part of a conversation to have during those forecasting meetings and just overall discussions between sales leadership and the people that are out selling on the street. So I would just make that and just letting us, constantly talk about, what structures are available, whether it's something short term or long term or fair market value or, whatever products that we're seeing a trend that's happening. I think it's important for us to tell our partners, but have an opportunity to tell them. And then really, I think it's just work together closely. I think build a relationship with your folks at DLL and vice versa, and give us an opportunity, give us a shot. I mean, it's been successful for so many partnerships, and I'm positive we can help them in the future.
Thank you so much, Steve. This has been awesome.
You are so welcome, Lauren. You are so welcome.
You are the best. Well,
it's great to share some time with you today.
Thank you for listening to The Pulse with Lauren Baingo, a DLL podcast series. The opinions expressed in this podcast are solely those of the participants. Nothing herein should be construed as legal, tax, accounting, or investment advice. Join us again for the next edition of The Pulse. And thanks again for listening.